Okay, this is part 2 of the KIN 3025 palpation video. Now I'm palpating the humerus. The humerus is this bone right here, and we're going to palpate the different parts of it. We're going to start with the head of the humerus, which is going to be right up here on the end of the shoulder. Next is the deltoid tuberosity. In order to find the deltoid tuberosity, you're going to have your patient turn their hand and push their hand into yours. And the deltoid tuberosity should, can you rotate your arm a little bit? Yeah. Deltoid tuberosity is right about there. Next is the greater tubercle and the lesser tubercle. So the greater tubercle is going to be on this side, and the lesser tubercle is going to be on this side. Next is the intertubercular groove, which is going to be right about here. And then the neck is going to be right there. Okay. This is for KIN 3025. This is part 3 of the palpation video. Next, we're doing the shoulder joint musculature. First up is our deltoid. This is the deltoid. It has the anterior, lateral, and posterior sides, and the deltoid is a main abductor. Next is the pec major. Go ahead and turn this way for me. You have your upper fibers of the pec major, which are going to be up here, and then the lower fibers, which are going to be down here, being respectful. The pec major's main movement is adduction. Next is the latissimus dorsi. Can you go ahead and lift your arm for me? The latissimus dorsi is going to be all of this area right here, and the main movement that latissimus dorsi does is extension. Next is the teres minor, which is going to be right deep to this, and the teres major function is adduction and internal rotation. Next, turn this way for me, is coracobrachialis, which is deep to this, and the coracobrachialis helps with flexion. Next is the serratus anterior. Go ahead and lift your arm up. Serratus anterior comes down this way, and the main movement that serratus anterior helps with is protraction. Next is the pec minor, and then pec minor is going to be deep to the pec major, but in the same area, and the pec minor helps with extension and elevation and protraction of the scapula specifically. Next is the subclavius. So you're going to find your clavicle and go right underneath the clavicle, and that's the subclavius, and its main job is to help with stabilization. Next is the trapezius. Go ahead and turn around for me. And the trapezius goes from here down this way. And the main function of the trapezius is to help with rotation and stabilization as well. And then deep to the trapezius, you're going to find the rhomboids. You have your major and your minor rhomboids on each side, and those help with retraction of the scapula. And then last but certainly not least is the levator scapulae, which is also deep in here, and that helps with elevation. First part of my KIN 3025 video, these are the palpations for the shoulder. Okay. We're going to start on the front with the clavicle. The clavicle is the protrusion right here. The clavicle has two ends, the sternal end, which is closer, more medial to the midline of the body, and then the acromion end, you just follow it all the way out, and it ends right on over here. The SC joint you're going to find by the sternal end. The AC joint you're going to find by the acromial end. Next, I'm going to have you turn around for me. We're going to do the scapula. Can you put your hand behind your back? This is the scapula right here. It's kind of hard to see on a black t-shirt, but there you have the medial border, the lateral border, and then this part that comes down right here is called the inferior angle. The spine of the scapula is this part up here that you can see if they elevate and depress their shoulders. Elevation, depression, it's right there. The next part of the scapula specifically is the acromion process, and then the coracoid process, which is going to be right in there. The manubrium is right here. If you find the sternum and you find the clavicular notch, you're going to just go down. That's the manubrium.